When you go on the typical health podcast right now, keto's out, right? Carnivore's out. But people are trying to figure out what is the key. And it's not just that simple, right? It's not. It's an intricate system and formula because we are intricate, very complex individuals in a very complex world. So maybe we can start before we get into the 5 disruptors. What has changed? Why are all of these symptoms coming up? And I'm getting people out of the woodwork saying, I haven't changed anything, 10 pounds out of the blue since Christmas. I eat hardly anything. I'm down to 4 foods and I'm gaining weight. And little do they know that 2 of those 4 foods are in the 5 health disruptors, right? So what is going on?
Well, we've had a systemic change over the last 4 years. The introduction of the pandemic fundamentally changed many of our biochemical systems in our bodies so that the way that we used to respond to things are now different. The mechanisms of action changed. And weight is one of the many factors that has changed. I call it the COVID-19. We think about the freshman 15, and I call it the COVID-19, and more than that in many cases. So why? And we'll get into the 5 disruptors, which the pandemic has had an exacerbating impact on, but it was first the food supply. Also, what this pandemic has fundamentally changed beyond the mechanisms of action are undergirded in pathogenicity. And this is one of the 4 portals of genetic expression for the Cochrane method. And we know clinically that the spike protein, however it got into your system, is now reactivating varicella, Epstein-Barr, cytomegalo, the herpes family, Coxsackie, and even mimics the glycoprotein in the MMR vaccine that then disrupts insulin. Just before we aired, I saw a client who drove all the way from Florida to see me. She's doing much better. I've been working with her family. I forgot how long. I helped her dad long ago. And she had been a client of mine and then moved, and she called me. She's like, nobody can figure me out. This was a month ago. So I thought, I have to come back to you. And what we discerned was, and this is new, varicella is really, really, really a nasty little sucker. Sort of like the Joker in, Batman of the supervillains. That was the most scary one to me. So varicella is now attacking the trigeminal nerve, which is called the suicide nerve. And people are having significant what perceives to be dental issues because they can't bite anymore. There's so much nerve irritation. So they go and they're put on antibiotics and they're put on a root canal. Then they are given a crown. And ultimately, it's the inflammation of that trigeminal nerve that is causing tremendous pain. Varicella also impacts the lower colon for ulcerative colitis. It increases estrogen and it exacerbates PCOS. It's been tied to Bell's palsy. We just had an MS reversal because of the varicella virus. We also worked with this is N of 1, a 3rd stage colon cancer individual that was told she was going to have her colon resected. And it was a very, very aggressive cancer, and it's gone. Now, we worked collaboratively, but the doctors couldn't believe it. And she said she's felt the best she's felt ever while she was having chemo. And when they went back to remove the tumors, they were just scar tissue. So we tied varicella to many other things as well. So GI, neurological, dental, if you will, endocrine. So that one's a big one. And we're very viral as a population, and I'm pioneering in the amyloids, which help to reactivate viruses. So there's just been a lot of change in our pathogenicity, in our mechanisms of action, in our detoxification systems because of the changes, our liver, our kidneys, our lymph, our skin. So those are, we'll get deep into it, but it's just fundamentally different.
Yeah, and I just speaking of the varicella virus, if you've been listening to me, you know that it was found and Teri found it, and then it was confirmed by an actual physical scan that I had the varicella virus in my optic nerve. And what's funny is I saw a practitioner that is not a health practitioner, a different type of practitioner, and I mentioned I mentioned my optic nerve and blurred vision, and he said, yeah, a lot of people are experiencing optic nerve issues. And he's not a practitioner. He doesn't know anything about the varicella virus, but he's seen it. And that I've also had 2 people in my life that have been hospitalized with ulcerative colitis out of the blue. And I actually was just contacted about a nerve issue in somebody that's unknown cause, and they are seeking guidance, and I'm wondering if it has to do with the varicella virus. So all of these things are coming up, and I have people in my life that just want to lose weight, and they're like, Sara, you don't know what you're talking about. I'm going to start eating chicken again. I'm like, well, okay, chicken is the low calorie white meat. I understand that, but it's not just about calories. There's so much more that is going on. And I can tell you just on a basic level, and tell me if I'm wrong, Teri, if your immune system is lowered because it is fighting something that this chicken low calorie white meat triggered, then your metabolism's going to lower. Your thyroid's going to say, hey, we got to save those calories because we got to strengthen this immune system and fight something off.